So good evening. My name is benpazi. I'm a pediatric neurologist specializing in movement disorders. A year ago, I founded NeuroCan, which is a service to provide accessible health care to the periphery. I've never planned to be a businesswoman nor to be a health care manager. It just happened when I saw my patients' unmet needs and the underutilization of digital health from the conventional system. The first patient I've seen was a patient from Eilat who had to come for a follow-up visit for 15 minutes. I told mom, no way you're going to travel for 8 hours with a child in a wheelchair for a simple 15-minute follow-up. So I did it on Skype. Mom was skeptical, but it worked. So I saved that day's travel for this patient, and I myself began my journey with telemedicine. At first I thought telemedicine, it was all about accessible care for people who live in distances, in rural areas. I remember one day a child coming into clinic after he had a seizure. I said, well, come into clinic early in the morning, and I knew he lived just across the street from the hospital. And he came in. He came in with mom and his older brother who had to take another day off work just to carry physically the child in. Now, today, when we buy tomatoes online, we know that video conferencing is very effective for medicine. For instance, I had a father walk into clinic, and instead of seeing me, he saw a tablet, and he thought someone is pulling the stump there. His wife forgot to tell him that the visit is going to be online. He said, look, I'm not a geek freak, maybe we'll do something else, but I'll give it a try. And at the end of the visit, he was amazed. He didn't assume that this is so effective, and we know it's effective. Telemedicine is spreading all over the place. Big telemedicine companies doing primary and secondary healthcare. We just concluded a study with ADHD. 100%, all the kids who we recommended treatment actually went and took the prescription. 72 adhered and refilled the prescription. So people really accept this as regular healthcare. A month ago, a patient contacted me, a parent contacted me, and requested I'm going to see his child that has a very unusual rare disorder. I am a word specialist in this very unique disorder called Sydney's chorea, and he wanted specifically to see me. I told him, well, you know, I really don't have the insurance coverage for the US, so we can't do it. He said, please, I promise not to see you. So the insurance said, okay, go ahead, and we did the visit. And then I realized that accessible care is actually needed for these rare diseases. Because when you have a child or a person with a rare disease, most probably that the unique specialist does not reside next door. He doesn't live in the same country. He probably practices medicine in a different continent, in an academic facility. Now, he would like to see you because it's interesting for him and this is his specialty. But maybe she can't. People do not have, in the academic world, time or resources to develop things further. So what we suggest is a SpotOnClinic, which works as the same model as Airbnb and Uber. And it works this way. You have a patient with a rare disease. Now, the patient can pay well because he knows he cannot get these specialties within his healthcare clinic. Most of the payment goes directly to the doctor. Some goes to the platform. The platform then supports quality assurance and referrals and insurance to the system, while the doctor provide specialist care, the expert care. The data is stored for big data uses. Now, when we speak about big data, usually we speak about common diseases. For the rare diseases, we really need to collect the data. Moreover, this model, I think, when you think about Airbnb and Uber, what they really did by connecting individuals in an intimate way, they actually introduced trust into the system. And I think that medical system sometimes lacks trust. And if we can bring in the trust into the system, we can actually reduce insurance and make things better. Remember, a century ago, doctors would go from house to house to see their patients. The reason that the outpatient clinics were established were to save resources, to save travel. Today, if you think about it, maybe there's no need for outpatient clinics, especially in neurology, where the whole examination can be done by observation. Neurology is a specialty that is based on observation. You can actually assess motor and functional goals by observation. This is what we do. And we can bring the doctors back home again. And so if you know about people with rare disorders, unique doctors, interested agents, medical agents, and cool investors, we'll be happy that you'll spread the word. Thank you. I'm going to present the speakers for tonight. We're going to hear about, when I chose the speakers, I wanted people from different areas to see how connections work between medical and. So we have medical and mobile, Itai, and we have Yuda, medical and agriculture or farming, and then we have Efrat, is medical and computers. So I hope you enjoyed this evening, and afterwards, whoever wants to present themselves and pitch for a minute, more than welcome. Thank you for coming.